Both NDP leader Thomas Mulcair and Green Party leader Elizabeth May have made campaign pledges to expand prescription drug coverage for Canadians. But it's not an inexpensive proposition. Joining us now for more on what a national Pharmacare strategy might look like, we welcome Dr. Danielle Martin, Vice President, Medical Affairs at Women's College Hospital and co-author of Pharmacare 2020, The Future of Drug Coverage in Canada, and Carlo Berardi, Chair of the Canadian Pharmacists Association and a community pharmacy owner in Sudbury, and we're happy to have you two in our studio here in Midtown Toronto. Sheldon, if you would, we'll bring this up here. This is from Pharmacare 2020. We're calling this the dope on pharma. 500 million prescriptions filled at retail pharmacies in Canada this year at a cost of $30 billion. That's 4 times what we spent on prescriptions 20 years ago. Public drug plans cover 42% of all prescription drug costs in Canada. Private drug plans cover 36% of all prescription drugs in the country. Canadians themselves pay for 22% of all prescription drug costs out of pocket, and that works out to about $6 billion a year. That's the lay of the land right now. So, Carlo, when we hear candidates promising a national Pharmacare program, what are they referring to?
Well, we're encouraged that there is a discussion about Pharmacare at the national level in the campaign debates. Everybody has a different opinion of what Pharmacare is or what should look like, and we polled Canadians in regards to what their vision of Pharmacare was, and I think the fundamental vision of Pharmacare should be that no Canadian should be left behind. When you refer to the 22% of Canadians out of pocket, a lot of those Canadians have no coverage. And we know from our studies that about 1 in 10 Canadians have difficulty or have problems with affording prescription drugs.
I actually got all the numbers here from your survey. So let's just go through these briefly here. 79% of Canadians support the idea of a national Pharmacare program. 31% of Canadians support replacing all existing plans with one universal plan. Nearly half of Canadians support covering only those who are not currently covered. About a quarter of Canadians support only covering those facing extreme circumstances. That's your survey done by Abacus Data. What do you infer from all those numbers?
Well, I think there's fundamentally 3 things. One, first of all, is that those Canadians who have private insurance coverage, there's an 80% satisfaction rate with their private plan. But at the same time, Canadians have a high moral responsibility for their neighbors. And we all hear stories about, the family that faces drug costs and can't afford them. And so generally Canadians really want to ensure that no Canadian is left behind, that while they may have private insurance coverage, they want to make sure that their neighbor who has no insurance coverage does have options. So
when you hear national Pharmacare strategy, what are you thinking?
So I'm thinking about more than just covering everyone, although covering everyone must absolutely be one of the core principles. We need universal coverage. We don't currently have it. But beyond covering everyone, we needed a greater incentive to quality in the system and better control of costs. So when we talk about quality, if you look at the proportion of Canadians who have employer-based drug coverage, virtually all of those private plans cover every drug for everyone, no matter the cost, no matter the appropriateness. And that's how we've ended up in the situation that we're currently in, where ironically, some Canadians can't access the medicine that they need, and many Canadians are actually being over-medicated. So for example, we know that 1 in 3 seniors is currently being prescribed a medication on the Beers list, which is a list of medicines that should never be prescribed to people over the age of 65 because they're dangerous. And so at the same time that we have under-access, we have too much medicine being given to some people, and our private plans are not able to promote that quality agenda because the incentive for a private plan is to have more prescriptions file through and to make the money that way. The third aspect is cost. So we know that in Canada we currently pay 35% more than the OECD average for our prescription medications. And so the reality is actually, at the same time that we have people who can't access their medications, as a country we are being ripped off, and we are not in a situation where we're getting good value for our dollars. And so Pharmacare has to include not only universal access, but also an incentive to quality and reduced costs.
Lots to unpack there. So, you've made the compelling case for why we ought to have a Pharmacare program. If this makes so much sense to do, Carlo, to you first. Why don't we have one already?
Well, you probably have to go back to where healthcare, and how it's delivered. We have 12 jurisdictions, and each province is responsible for the delivery of healthcare in the province. When I started in pharmacy about 30 years ago, it was rare we would have a prescription that cost more than $20, $25. And most Canadians had a private plan. So there was never really a concern as far as affordability of prescription drugs. But, especially in the last 10 years, we see an evolution toward a lot of, while they're very effective, but very expensive treatments. And these are treatments which are posing challenges to not just private payers, governments, and everyone else. And so, I think everybody's challenged now. If you talk to any provincial leaders, they're challenged to find ways to fund new or expensive treatments. So why did we end up? Well, it's probably because each jurisdiction did it themselves, and now we have 12 jurisdictions all trying to figure out a way forward.
Well, one of the reasons we do is because our Constitution says healthcare is a provincial responsibility, and the current federal government believes that it ought to stick to its knitting and not involve itself in provincial affairs, which is why the Conservative government doesn't believe in a national pharmacare program, at least not the likes of which you're talking about. Is that a fair point?
Well, for sure, it's a fair point that healthcare falls within provincial jurisdiction, but actually the federal government is already very engaged in the drug file. So we need to kind of separate the delivery of frontline healthcare services like doctors and hospitals from pharmaceuticals. Right. Health Canada already does our drug approvals and our drug safety assessments. Right. The Patented Medicine Price Review Board is the federal body that deals with pricing of patented drugs. So there's actually, and of course we also have federal involvement in providing prescription drug coverage not only to all federal employees, which is actually a huge number of Canadians across the country who work for the federal government, but also for the populations that the feds are responsible for, Aboriginal Canadians, veterans, et cetera. And so the federal government is already in the drug assessment, technology, safety game, if you will.
And therefore?
And every single party, including the Conservative Party, has said that they see a role for the federal government in trying to push this item on the agenda.
But not necessarily being the single purchaser of a national pharmacare strategy.
Well, I actually think that we might be surprised, no matter who wins this current election, at how this file evolves over the coming years. Because what Carlos said is absolutely right. We have a huge number of very expensive drugs coming down the pipeline. And we as a country are going to need to come together to figure out how we're going to manage that. No government of any political stripe is going to be able to stand by when Canadians are faced with costs in the literally hundreds of thousands of dollars per year of treatment without trying to figure out a way to join together in order to meet that challenge.
You both know Andre Picard, who's an excellent health writer for the Globe and Mail, who not too long ago had this to say about this issue. The other approach is to make drug insurance mandatory, as Quebec has done, so that it is provided by employers, purchased privately or from a low-cost public plan. In fact, since Quebec adopted Pharmacare in 1996, costs have soared because demand has soared, to the point where the provincial health ombudsman has warned that it is unsustainable. The Quebec experience is a sobering reminder that programs hailed as money savers rarely turn out to be so. This is problematic, isn't it?
Well,
there's no silver bullet here.
Absolutely. Again, but the Quebec model, more people are covered now than before, and so there's more participants in their program. But we have to balance that off between, medical adherence and better outcomes, and whether people are keeping out of the hospital. We know diseases such as hypertension and diabetes, if not properly treated and properly not medicated, can have tremendous costs on our healthcare system, hospitalization, et cetera. So, we have to really kind of look at the overall healthcare budget. We know that prescription drugs are 15% of our healthcare expenditure. So the question becomes, is that 15% investment saving on the other 85% and giving us better healthcare outcomes?
I hear you, but Dr. Martin, I'm going to put it to you that governments haven't done this so far because they're terrified that at the end of the day, the costs are going to go through the roof and they won't be able to afford it anymore.
Absolutely, and the Quebec model is a cautionary tale. What the country should learn from Quebec, and the leaders of the Quebec program have said this themselves publicly, it is not the way to design pharmacare. Essentially what Quebec did was they left all of the private employer-based insurance plans intact. They said to employers, if you provide any benefits to your employees, you absolutely must provide drug coverage. And then they layered on top public coverage to try to cover for the people who were falling through the cracks. And when you do it that way, you can't get any price savings. So the reason why the Quebec model has become so expensive is not just because demand has gone up, it's because they have not effectively used the bargaining power that you have when you're a jurisdiction buying the drugs for the entirety of the nation or the province or the jurisdiction in order to bring costs down. And this is one of the main reasons why we pay so much more than other countries for our drugs. We have literally dozens and dozens of purchasers of drugs in Canada. You can't get the prices that they get in the UK, in the Veterans Administration in the US, even in France, Germany, Switzerland, Australia. You can't get those kinds of prices when you're buying for a few hundred people at a time. You have to go all in as a country, and that's how you can bring the prices down.
So redesign it. How should we do it?
So what we should do is have a single purchaser that buys in bulk the drugs for the country, that negotiates the prices with the pharmaceutical companies who produce those drugs. And if we were to have even the worst performing system in the world on pricing, but better than we have now, we could save literally billions of dollars as a country. And what you want is an arm's length body or agency, and we actually have probably the capacity to do this already in the system right now with a little bit of rejigging, to develop what's called a formulary or a list of drugs that would be covered for all Canadians based on the best available medical evidence, and that would be free of industry interference and political interference, because that's how you end up with non-evidence-based decision-making in terms of what's covered. And if you could do that and join together in the way that you negotiate the prices and purchase the drugs, we could actually cover everyone in the country for probably no less than we already spend publicly, because we would be getting so much better value for our dollar.
Any objection to that idea?
Well, cost containment is only one part of the Pharmacare model. And every jurisdiction in the world is struggling with affordability of prescription drugs. So this is not a unique Canadian experience. But some countries which have strictly pursued a cost containment strategy have had some consequences as a result, where there be research, development, innovation, and medically available medications.
But let's stick to the issue here. A single, all-powerful, able to negotiate cheaper prices purchaser for the country.
There has to be more to Pharmacare, and when you look at a single national Pharmacare. We have to balance the value, the quality, the research development, the innovation, and what benefits Canadians are going to get from that Pharmacare. So there's many models that you can look at, cost-saving initiatives. For example, in Ireland, and which has a national health strategy, they were able to negotiate with one of the manufacturers on a new medication for treatment of MS. The deal struck was the manufacturer would supply the medication free of charge for the first month. If the patient resulted in an improvement in their walk score, the government would pick up the cost of the medication for the patient. So I thought that was innovative, and that's what really...
Okay, but what's that got to do with the question I asked? The question I've asked is, what's wrong with a single, overarching purchaser of medications who would presumably then be able to negotiate cheaper prices on behalf of patients in the whole country? There's
nothing wrong with having, getting the best value for Canadians. What Canadians want to see is a lot more from their Pharmacare program. It's not just about, we know that prescription drugs are 15% of the total healthcare cost. So just pursuing a strictly cost containment strategy and saying that we are going to purchase, molecules from around the world at the best possible price may not be the best interest of Canadians.
Hold on one second. He hasn't said this, but one of the things I've heard is, you can't do this because Big Pharma will get mad and they'll leave. And we can't have that.
Right.
We've got hundreds of thousands of people who rely on having some multinational pharmaceutical company presence here in Canada.
Right.
Is that a legitimate concern?
So actually, if you want to know how that's going to look, you just have to look at literally every other developed country in the world. Like every other developed country in the world does this except for us. And so the answer is no, we're not going to chase the pharmaceutical industry out of the country. There's actually no relationship, no correlation between the prices that a nation pays for its drugs and the amount of research and development that the pharmaceutical industry does in that country.
So why do we keep hearing that?
So the UK, well, look, there are profits to be lost. When we talk about reducing the price of drugs, there are three groups that are going to see their profits decrease as a result of that, unless we can figure out how to make them whole.
I would be concerned about that if it meant that a lot of the R&D that these companies do in Canada would no longer be done.
So the UK, just as an example, the UK gets much, much better drug prices than we do, and they have 5 times the amount of investment per capita in R&D in the pharmaceutical industry, in the pharmaceutical realm in their nation. And so there are other things that you can do as a country to try to make yourself friendly to R&D and to pharmaceutical industry investment. It has to do with science policy. It has to do with how much you fund basic research. It has to do with having a streamlined process for drug approvals. So there's lots that can be done to make Canada an attractive place for the pharmaceutical industry to invest, but we shouldn't have to overpay by 35% for our drugs in order to convince them to stay and continue to do research here.
Can I sneak this last graphic in here, if we can? This is from Yannick Lebris, who's an economist at the Montreal Economic Institute. Doesn't share your view on this, Dr. Martin. You won't be surprised to hear. Here we go. What these supporters, I think he means you, fail to mention is that such programs keep spending in check by rationing access to new drugs, rather than by being more efficient. Foreign experience can teach us much about the dangers of adopting a monopolistic drug insurance plan in Canada. The UK is among the countries that have pushed this line of reasoning the furthest. As a result, UK patients for many years had to do without drugs that were approved and recognized as effective and available all across Europe. These restrictions have, in all likelihood, played a role in the UK's lower cancer survival rates compared with most other industrialized countries. Want to speak to that?
Well, all the other European countries that he's talking about also employ the kinds of strategies that we're talking about. So nobody's talking about doing, the UK model per se. But I do actually think that it's important for us to have a conversation about new drugs. Where new drugs are known to be effective and the science is there and we know that they actually do improve survival rates, absolutely, we should cover them. And remember that in our current situation, thousands and in fact millions of Canadians are going without access to necessary drugs at all. So it's not as though we're starting from a really terrific standpoint right now. But where new drugs are more expensive and offer no clinical benefit over their less expensive predecessors, we need to talk about whether that's a good investment of public or private money. And right now, we don't have that conversation.
You want the last word on this?
I thought our discussion here was Pharmacare. and Pharmacare is more than just about buying medications. It's a whole approach to delivery of pharmacy care in Canada. We know that Canadians want more than just drug coverage. We know Canadians want access to pharmacy service, whether it be vaccinations, medication management programs, or interpreting lab values and prescription management services. So when we talk about Pharmacare, I hope that we have the discussion not on just strictly on a drug purchasing side.
You think it's a bigger story than that?
It's a bigger story than that, and it's after all, it's called Pharmacare, not anything else. So, and that's what Canadians want. I mean, when we polled Canadians, Canadians like their private insurance. They want to see more pharmacy services part of their Pharmacare, and they want to ensure that no Canadian is left behind. And we have to bring those fundamental issues into a national discussion. And we have to look at, yes, I agree with Danielle, there have been success models around the world, but we have experts in Canada. We have to come up with a unique Canadian perspective on how we're going to move forward on Pharmacare, how we're going to get the best quality and the best outcome at the best reasonable price, and balance that all with the economic development of the country, whether it be research and development, whether it be innovation. I'm not here advocating for anybody individual, but a Pharmacare program has to be a good discussion. We've got to bring these experts in.
Speaking of a good discussion, we've
Yes.
just had one, and that's our time. Danielle Martin, Carlo Berardi, thanks a lot for this very balanced debate here in our studio.
Thank you.
Help TVO create a better world through the power of learning. Visit supporttvo.org and make a tax-deductible donation today.